Welcome to my presentation where I will be discussing how the LGBTQIA community is a marginalised and disadvantaged group in society. LGBTQIA+ community is an acronym for those in the lesbian, gay, bisexual, transgender, queer, intersex and asexual community. Many people within this community or group may identify as more than one of these words in the acronym through their gender and sexual identity. For many years, the LGBTQIA community have undergone consistent disadvantage and marginalisation due to societal norms and expectations regarding gender and sexual orientation. Although there is an increasing acceptance for this community within laws and society, they are still one of the most marginalised groups in Australia and around the world. This has led to issues such as increased mental health issues, bullying, discrimination, and higher rates of substance abuse. Mental health. With 11 in every 100 people in Australia identifying in the LGBTQIA community, it is important that we consider what makes this group marginalised and disadvantaged in order to create change. Mental health has become an important issue within Australia, especially within this community. What are the facts? In 2021, it has been reported by LGBTQIA Health Australia that those within this community are 2.5 times more likely to be treated or diagnosed with a mental illness in the past 12 months, in comparison to those who are heterosexual or cisgendered. Other statistics relating to mental health and the LGBTQI community include 24%, which is almost 1 out of 4, of 12 to 14-year-old suicides are of this community. 1 in 10 suicides under the age of 30, and 57% of those identify as male. When we look at these alarming rates of mental illness and suicide within this community, it is important to explore the factors that contribute to these high numbers. Bullying and discrimination is one of the key factors relating to this cause of mental health issues amongst the LGBTQI community. Much of this harassment is in youth, happens within schools around Australia. The Australian Human Rights Commission found that 80% of LGBTQIA youth were bullied within school due to their gender or sexual identity, claiming that it had significant impact on their mental well-being. There are many reasons as to why bullying of this sort occurs. Many school-aged children who bully others that identify as LGBTQIA reflect societal and family views towards the group. Lack of education and understanding about this group also leads to fear and isolation, as harmful homophobic and transphobic views are often the reasoning for this bullying and harassment. The next slides will be about substance abuse within the LGBTQIA community. We will be looking at the facts and causes surrounding this topic. There are many factors that can lead an individual to struggle with substance abuse throughout their lifetime. It is often used as a coping or escape mechanism for those dealing with hardship. Individuals who identify as LGBTQIA have a much higher rate of drug and alcohol abuse. So what are the facts? The Australian Institute of Health and Welfare reported that in 2019, 40% of homosexual or bisexual people had recently used illicit drugs. In 2010, it was reported by the National Drug Strategy Household Survey that 28% of gay and bisexual individuals were daily smokers. However, this then dropped to 16% by 2019. The same report states that people who identify as LGBTQIA are 1.5 times more likely to smoke daily. LGBTQIA are also 1.5 times more likely to exceed recommended alcohol consumption rates throughout their lifetime. Causes. Risk-taking behaviour is a common trend that we see in marginalised groups, and for a large majority is due to coping with hardships faced. with many LGBTQIA individuals facing higher rates of suicide, mental illness, homelessness, abuse, and discrimination on average, it can be seen why drug and alcohol abuse is seen as an escape or a way to cope with their hardships. The American Addiction Center in 2019 explains that the main reason for higher substance abuse in the LGBTQI community are linked to lack of support, discrimination, and internalized homophobia. Internalized homophobia is when an individual believes the stigma or stereotypes placed on LGBTQI are true and it applies to themselves. This causes resentment and hatred to one's own self-worth. This can also lead to high levels of substance abuse in order to silence or cope with this destructive internal monologue. People who are often not out or public with their sexual or gender identity often grapple with a negative self-image. However, there has been a rise in organizations dedicated to helping LGBTQI youth and adults who are experiencing substance abuse-related problems. Some of these organizations include Q Health, Pivot Point, ACON, and LGBTQI Health. In conclusion, there are many factors that contribute to LGBTQIA being a marginalized and disadvantaged group. With discrimination, homophobia, transphobia, bullying, and harassment still prevalent in our society, this community is consistently bombarded with challenges that result in mental health issues, homelessness, substance abuse, and more. Further education and acceptance within society, as well as providing more support for this community and individuals, these challenges can eventually be overcome.